Good morning, everybody. My name is Akanksha Kalra. Thank you for joining us today. I am originally from Punjab. I studied in Delhi and now live and work in Philadelphia, Pennsylvania. I work as an attorney in private practice, and my practice is exclusively focused on US immigration law. I also serve as a co-chair of the Philadelphia chapter of Punjabi Chamber of Commerce. PCC is a nonprofit organization, a community of individuals, business owners, and professionals I believe now we have 20 global chapters located in North America, Europe, India, and also in Australia. PCC provides advocacy on behalf of its members, opportunities for mentorship, education, and collaboration, and group benefits such as classifieds, member directory, and networking events. PCC membership is free. It is my pleasure to welcome you all here today to this PCC Global webinar, Women, the Heart of Healthcare. I would now like to invite Gunjan Syal to tell us more about the topic for today's discussion and also introduce our speakers. Over to you, Gunjan.
Thank you so much, Akanksha. It's a great pleasure to be here in the company of so many wonderful women. And my special thanks to Punjabi Chamber of Commerce for working with me to organize this session. I should mention that this is a co-hosted session between TED Circles, which is another organization that I'm a part of, to spread global knowledge, through remote channels and digital channels these days as well. So as Akanksha said, my name is Gunjan, commonly known as Gunjan from Go Emerald. They go hand in hand together. I've been a consultant by trade. I have 15 years of experience enabling high ROI innovation and transformation for clients in North America. So that's consultant speak for anytime you have a complex technology problem. I get pulled in. And through that experience, I've met so many great people that have tried to bring change and innovation in so many different sectors as well. So we'll meet three of those women with us today on this stage. But before I bring them on board, I would like to mention that we will run this session today in a very interactive fashion. So anytime when we're having this conversation, I would like to invite you to just raise your hand. If you can't find that setting, Jania, I'm not sure actually if there's a chat feature that's working. I hope people can either use
It's
chat.
working. Yeah,
Wonderful.
it's
Thank you
working.
so much for confirming that. Jania is also our host on the technology side for today. So thank you so much for doing that. So please feel free to use the chat. Please feel free to raise your hand if you'd like to verbally contribute to this session. What I would like to do now is basically introduce three incredibly accomplished leaders to you today who have driven, I should mention during any time we need leaders, right? But over the last year in healthcare, it's been a journey to bring change and transformation in it. So what we have for you today are three change agents along with three leaders. So I would like to invite each one of them to first introduce themselves and second, share a little bit of their journey over the last year, because I think it's so important for us to hear that. What have been some of the challenges? What have been some of your successes? And what do you wish that you could change in that journey? Because, as inspiring and aspiring leaders that we have in the attendees today, I'm sure people would love to know that. So first, I would like to invite Susan So, who is the founder and the CEO of a company called First Green. So Susan, welcome.
I'm just going to unmute myself. Hi, thank you so much, Gunjan. Thank you very much for everybody's time today. I'm really excited to be here. I'm Susan. I have over 20 years experience in operations. For those of you that don't know, operations is really a melding of people, processes, and technology. I've spent time in loyalty marketing, financial marketing, news media, and digital media. My expertise is really deployment of technology in a very massive way. So my last role, I was deploying content and technology in campuses across North America. I'm really an accidental entrepreneur, but a year ago this time, I became very mainstream when I lost my job in advertising media when everything shut down. And it was at that point where I had this opportunity to start a business. And to be quite honest, I wasn't one of those people that grew up saying, I want to be an entrepreneur, I want to start my own business. This opportunity really fell into my lap. whereby I had the opportunity. I was sitting at home, everybody was on lockdown, and I looked at this opportunity to start a health wellness screening company. And at that time, nobody was even doing health screening. So it was at that time where I thought, you know what, I'm at home already. I'll start calling my network and just say, hey, I have this idea, I have this opportunity. What do you guys think? And it was really from that moment, and we incorporated in June. Fast forward now, we're in March. I'm in beta sites of almost 9 beta sites across 9 different sectors. We're doing a shotgun approach. And it's been quite an incredible journey, primarily because I was able to tap into my network. And I accidentally, I think just my support team, they have been entrepreneurs themselves. And they said, Susan, you can do this. And there have been so many times where I thought, holy cow, I can't do this. And everybody would say, of course you can do it. Look at what you've done in the past. You could totally do this. So I'm really excited. I think the other panelists that I'm with are very well accredited, and I'm quite honored to share the screen with them today. And again, I'm an accidental entrepreneur in healthcare. Really happy to share with you later on some of my experiences.
Thank you so much, Susan. One thing that I will say, Susan and I have had the opportunity to work off screen a little bit before this session as well. And I know Susan's being very humble, right, by saying that she's an accidental entrepreneur, but there's a certain amount of strategy and this vision that comes with working in marketing as well. So one of the things that you had said to me, Susan, and I hope you don't mind me saying so, is you said that you don't want to be pigeonholed into healthcare. And I say that with all respect, right? No offense to healthcare or anything like that. It's a huge field. It's a very complex industry. But how I interpret that statement is, well, healthcare is good, but I want to be bigger than that, right? My vision and my appetite as an entrepreneur is huge.
Mm-hmm. Yeah,
right,
that's
Susan?
correct. And I think also with COVID, it's become so mainstream, making sure that people are healthy, your workforce is healthy. It's become so mainstream that it's a great opportunity for all of us to play in this space.
Right. And that's the vision for you for First Green, right? To ensure that all the employees for any organization, how to ensure their well-being, really.
Correct. Yeah.
Right. Wonderful. Thank you so much for sharing that. Now,
Thank
pivoting
you.
a little bit to Priya, who comes from actually a different part of healthcare. So I'm curious to hear about her thoughts as well.
Sure. Well, thank you so much. And thank you to all the organizations that have put this event together today for having me here. I'm excited to share a little bit about my journey. So I actually have about 17 years of experience in healthcare, and I started my career as a healthcare attorney. Straight out of law school, I happened to get a job at a law firm, and I love the partners that practice healthcare law. So raised my hand and said, that's the group I want to be part of. If you offer me a job, and thankfully they did. So I spent some time in a law firm. I went in-house at 2 different hospitals and health systems. My last sort of stop on my legal journey was being general counsel of Georgetown University Hospital and Washington Hospital Center in the DC area. At that point, I realized I want to try something new and I want to pivot. And so I switched over to health policy, and that's when I came to the American Hospital Association, which is where I currently work today. And I started as a member of the policy team, lobbying and advocating for hospitals and policies related to inpatient payment, rural hospital payments, and then generally looking at new ways to deliver care and new models to deliver care for communities that may have to close their hospital. About 4 years in, I decided I wanted to learn something new and pivot again. And I fortunately had the opportunity to stay within the American Hospital Association and do that because we were just starting to have this conversation around healthcare affordability and value, and what is the hospital's role in ensuring that the care that is offered to individuals and communities is valuable and affordable. And so raised my hand and said, I want to lead this. This is how I want to set it up. This is what I think we should do. And thankfully they said, okay, that's good. Let's do it. And so I got to start a think tank called the Value Initiative, where we looked at healthcare affordability and value. And that is now 3 years old and has been successful. So they've expanded my role, and I cover a variety of issues. And my title now is Vice President of Strategic Initiatives, which really means anytime there's an issue that our board or leadership believes is a priority issue for the field, that hospitals need help or resources to take on, it comes to my team. And we help hospitals do what they need to do. So we cover value, maternal and child health, the work on societal factors that influence health. And then throughout the pandemic, I was responsible for our 100 million mask challenge that helped increase the production of PPE for healthcare workers on the front line. So a really fun and broad variety of work, and very far from where I started as a healthcare attorney.
Absolutely. And it's one of those things, right? I'm forgetting the word for it, but there's a word for people like yourself, Priya, who can take on any field. They come from this particular, call it traditional, like a lawyer or a consultant type mindset, but then very quickly, whatever situation you're put in, you're looking for the most impactful way to make the change, to expand the piece of the pie, if you will, for everybody, right? And that's what COVID has needed, especially in healthcare. Because if I remember correctly, no matter where you are globally, right, ecosystem looks a little bit different, right? Even regionally, as you mentioned, the ecosystem in New York might be different than in Vancouver in Canada, right? So how do you quickly then go in and figure out at the hospital level, let's say?
Yeah. So, being at the national level and representing, over 5,000 hospitals is a challenge, right? So all hospitals are different. And we always say, if you've been in one hospital, you've been in one hospital, right? Because they all serve their unique patient populations and their unique communities. And so a hospital that's in the middle of rural Iowa is going to be very different than a hospital that is in the middle of New York City. And the needs of the patients are going to be different. But at the same time, there are those traditional needs that need to be addressed, like access, right? So we need to make sure that individuals can access healthcare. And that will look different in rural Iowa versus New York City, but the principle of access is still there, right? We still need to figure out how people can engage with the healthcare system. There are a lot of things that came up in COVID, like we call them the societal factors that influence health, but they are the things that we saw become so important outside the walls of a hospital. And we have to figure out how hospitals can play a role in addressing them. So for example, with COVID specifically, housing and food access were huge concerns. And I'll just dive into housing a little bit more, because if you don't have a home and a place to live, you can't socially distance, you can't quarantine for 4 days if you've been exposed to COVID. You don't have the things that we needed to protect the spread of the virus. And so all of those things became even more important for hospitals to address. And then, compounding that was all of the health equity issues around the ability of individuals to attain the highest health that they can because of racial disparities, gender differences, language barriers. And so all of that comes into play as hospitals are trying to figure out, how do we best take care of patients and families, and how do we meet them where they are so they can come and access healthcare?
Absolutely. And these are some of the factors when you really stand back and look at why healthcare didn't change for so many years. This is why, right? Because someone figured out this makes sense. And then we stuck with it until COVID. So now people like yourself are driving a lot of this change. So I'm glad to have you on board. Thank you so much for making time for this. And we're going to dive into some of those factors a little bit later. But first, last but not the least, I want to invite Payal, please, if you would introduce yourself and tell us how your journey has been throughout the last year.
Yeah, absolutely. Thank you to everyone for having me on this panel. I feel very honored and privileged. And so, my journey, I finished my training in the field of allergy and immunology in 2008. And I then chose 2010. And then from there, I took a 2-year sabbatical, which I like to talk about on these panels, just because I think it's really important for people to hear that you don't have to stay on this kind of just straight path of go, 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 do, and you can kind of veer off and then come back and still be okay. And so, I left the country for about 2 years, and I did some volunteer work in Liberia, Nepal, and India. And I also took time to just travel and see Southeast Asia. So it's probably 2 years of my life that I will never, ever forget, and really taught me so much about myself, about life, about global health, really. I had the opportunity to work in two very rural hospitals, one, like I said, being in Liberia and the other in Nepal, and then a larger city hospital in India. And I just saw healthcare in such a different light, and just I appreciate the differences. There's actually like some things about rural healthcare that I wish we could bring into our healthcare system a little bit more. And then there's things from our healthcare system, of course, that I wish we could bring into the rural space. So it's, there's just a lot of things that I learned from that journey. And so I hope that people will take this as just a reminder that you can do things like that and take time off to see the world. And so, once I came back from there, I went into private practice, working for I actually worked for one large allergy group when I first came back for about 3.5 years, almost 4 years. And then I switched over to another large ENT and allergy group that I worked at for almost 4 years also. And I actually put my resignation in October during the pandemic. And there was a lot of change that happened to me, for me in this past year. One is that I became a mother. I have a new 8-month-old who is just learned how to crawl last week. So he's on the move now. And that was scary, to be honest, to be pregnant in May during the height of the pandemic in New York City, which is where I live. And practicing medicine at that time was also really scary. I remember just right now during this time last year, being in clinic and just being scared every day going into the office. And actually I'm choking up right now because it was so scary. And it reminds, it's just a reminder of everything that's happened in the last year. But yeah, going into the office was scary. And when we finally went into lockdown and then decided that our practice would go and do telemedicine, it was a nice breath of I was able to breathe finally. And then right around that, literally the first day that I did telemedicine from home, my friend that I was monitoring at home became and was pregnant herself just a week ahead of me, actually acquired COVID, and I had to send her to the hospital. And she ended up getting admitted, being intubated, having to have an emergency C-section where she had a 24-weeker. And they're both totally well, doing great. They're both healthy and well right now. But that was the scariest 10 days that I've experienced. And that really, pushed me into this whole pandemic life very strongly. When I speak to that experience just because when I felt scared, I also felt a lot of guilt as a healthcare provider, because I knew that my patients needed me. I knew that the healthcare system needed me, but I felt fearful for myself and for my baby. And I think that that was really, my friend's sickness actually allowed me to take better care of myself, because I was able to finally see how serious COVID was and how much I needed to protect myself and also protect my baby. More than anything else was protection of my baby. And at that time, it was very difficult in the healthcare space. And I know, Priya, you can probably speak to this, but I think as physicians, we were feeling very vulnerable, and we were feeling kind of not taken care of, to be honest. Not only the PPE issue, but then also just administrative issues, and just feeling like we were being pushed to our limits. And that's, not to speak negatively about anything that happened to me, but, that's when I kind of stopped and said, no, this is what I need for myself and my baby. And so I chose to take early maternity leave, unpaid early maternity leave, which ended up making it so that I had I ended up going on unemployment for a little while because I wasn't getting paid. And so, all of these factors led up to, and so anyways, I had been working or consulting with a startup from July of 2019. And when I talked to my co-founders, they kind of just said that, you know what, if you want to, we can bring you on full time. And that's when I became, a co-founder, a chief medical officer, and just, I resigned in October and started this new role. So that's kind of been my journey. And yeah.
Yeah, and thank you so much for sharing those deeply personal parts with us, right, Priya? Or not Priya, Payal. This just happened in the chat. I apologize. And I was thinking about that. Sorry about that. Payal, thank you so much for sharing that. So one thing that comes to my mind, right, especially as women, sometimes this happens with us. We get pushed into those predefined roles that society sometimes has, right? What does it mean to be a doctor? What does it mean to be an engineer or a lawyer or a marketing person, right? What does it mean? And there's very well-defined, predefined paths for us that we could travel. But you've shown us twice now that you can add value to the society. You can actually create more value for the society instead of just adding more value to it by taking a different path. So first you explored your journey outside of the US to Nepal, to India, and to some of these other places where you saw global healthcare. Every healthcare model, every ecosystem has its own gaps, its own value adds, and now you've seen them. You've brought them back with you. You worked as a doctor, you've seen that world, and now you're working with a startup, so you're mashing up different paths and creating success that way, right? So if you guys don't mind, Olu, who is another individual who has experience in healthcare, was just sharing her story in the chat that's very similar to Payal's. Olu, I would like to invite you to unmute yourself and share a little bit about it if you don't mind. Right, that would make it a nice two-way chat if you're up for it. Otherwise, I'm happy to continue the conversation through the chat as well.
Thank you, Gunjan. Good morning, ladies. Can you hear me?
Yes,
Okay.
we can hear you.
All right. I've always been drawn to healthcare because, Susan mentioned, being an accidental entrepreneur, I was an accidental politician. I was in the private sector and got into the public sector, serving my state as I would say on the board of tourism. And then after the 4-year stint, I went into development communication, which was being nominated as a municipal councillor for primary health care. And being a city girl, I'd never experienced, life in the rural area. And it was a rude shock to me. One, because I had never come in contact with the life, the struggles of women, just getting access to basic healthcare. And one of the things that shocked me was, in my municipal, we were rated 20, the 20th position out of 20 municipals. So you can imagine the very bad statistics that WHO kind of rated us. So it got me infuriated. One, as a person, how could my hometown be the 20th hometown out of the 20 municipals? So that meant something was wrong. So I jumped into assessing what the problem was. And I saw that they didn't have, the pregnant women didn't have access to healthcare on time. I wanted to know why there were high rates of infant mortalities, why there were high maternal mortality rates. And it was because they were far-flung from accessing just a general hospital. So basically, before they could get mother and baby to the hospital, the baby had died, the mother had gone into seizure or something. So that opened my eyes, and I saw that education was also part of the challenges. These women didn't know much about how to take care of the baby, what is needed to do for immunization. Some even kept their babies indoor when we were doing the normal polio polio vaccination, they didn't want to get immunization because they got wrong information that, the polio vaccination was going to turn their babies into, aliens or something like that. So it was a 3-year experience for me. But at the end of it, part of my submission, part of the achievements was we were able to build 4 strategic hospitals in the 4 geographic locations of the municipal, because it covered 15 wards. So, and before I came, it was only 1 general hospital that they could access. So my mission was to ensure that the municipal could provide 4 strategic hospitals in the geographic, the 4 geographical areas of, of the municipal. And by the time I left, we moved from the 20th position to the first position. It wasn't without a lot of challenges, because I was there to upset the status quo. Who is this woman politician, to come and tell us what we know or we don't know? And it wasn't without any of those challenges, but I was just hell-bent on the mission, and we were able to do all that we were able to do. And, being a city person, being a non-traditional politician, because they thought politicians were just to come in, and then go. But this one was not doing what other politicians were supposed to do, and it kind of put me on the other, it pitched me against a lot of, the people, in the municipal. But I don't take that experience for granted, because it inspired me to start a not-for-profit called Adopted Child Today after I left, because I then looked at the challenges. But there's still so much to be done, because my heart still bleeds at the situation, in the rural areas, because you have 70% of the population in the rural areas, and these are people that are dying by the second because of common, little things, that it's not supposed to be. So I kind of related to Dr. Payal's, experience, and I couldn't but just chip in that one. So for me, this is a beautiful, webinar. Thank you very much for having me to speak. Thank you, Guyan. Back to you.
Absolutely. Olu, thank you so much. And if you have any information about your nonprofit, I would invite you to put it in the chat so other people can see it and, support it, because it's such a great cause as well. And what you shared actually makes me wonder, right? The 3 questions that we had put on top of this webinar as well, we might as well dive into it, because Olu's leading us there. What is it that makes us an impactful leader, right? Especially in healthcare, because it's we discussed some of the challenges, right? Priya mentioned them, Payal, you mentioned them. There's so many different stakeholders, so many different challenges. Susan's startup is dealing with them right now as well, as it relates to policy and accreditation of your systems and some of those other things. So as a leader, right, as there's a traditional definition of a leader, right, the leader of people, but in this case it goes much beyond that, right? You're kind of dealing with a brand new problem with all of the people that are also dealing with it all at the same time, your customers, your stakeholders. How would you begin that journey? How would you start that? So anybody just jump right in, free for all.
Okay, I'm just gonna jump in there. I think right now, again, I call myself the accidental entrepreneur, and I think my cleaner once came over and she said to me, Susan, every problem has a solution. And I think in that nutshell, this is what this is. COVID is a huge problem, but there's also a solution. And I've spent a lifetime doing operations. That's what I do. I solve problems. And so I think there's an incredible amount of opportunity right now to be a leader in healthcare, because there aren't really any rules. And the rules that we have today will change 2 or 3 weeks down the road. So I love the fact, if you are anybody who wants to implement change or sees an inequality, I think for me personally, I managed a team across North America. I felt obligated to make these employees feel safe. And so what can you do as an organization to say, this is what I'm implementing at my place of work to make people feel safe, to go into these establishments. So for me, I think what I'm seeing is there's currently a lack of standardization. There's an ever evolving change of the environment. And it's a really good opportunity for you to say, what do you envision to be the gold standard? So on my decks, I say we're the gold standard because I'm putting myself out there because there's really currently no gold standard right now. So why don't I put my best foot forward and get it validated by users, by contacts, to start a business right now in healthcare. I think the great thing is there's really not a lot of expectations as well. And plus, it's easy to start a business because everybody's working from home. So they're not expecting in-person calls. So you're taking a lot of Zoom calls. So this week alone, I spoke to somebody from India, somebody from India, from Europe, and also from the US, all different time zones. So our personal lives become a bit more blended now, right? Everybody sees, where you work, what your artwork is. But I think also it's a great it's an open landscape right now to really put your best foot forward. And a lot of people are scared. So if you know that you've got a great solution, or you've got great contacts that can help you bring your idea forward, it's a great time to take advantage of it right now, because we're sort of stuck, like we're sort of home right now. I know in Canada where we are, we're just emerging out of our lockdown. In fact, in Toronto, we're still in a semi-lockdown situation. But I think what this is an opportunity to really make change, and COVID has become a catalyst. So we're not going to have sneezy people or people runny noses coming into the office now. Like those days are gone where you show up to the office like a hero. You're not a hero, you're spreading your germs. So again, it's good opportunity to map out what makes sense and to implement your idea and get people to sign on to that.
Yeah.
Oh, go ahead.
Yeah, I think it's, I just wanted to piggyback off of so many things that you said. Being that, the company that I am the chief medical officer and co-founder of is a telemedicine company, specifically in the allergy space. So, right now we're working with allergic rhinitis and conjunctivitis, and later on we'll be moving into the asthma and eczema and food allergy space. But I think, Susan, what you said about people not wanting to go into the office when they have that runny nose is just so perfect for what we're doing, and I actually noticed that even early on in the pandemic, just the security that was felt by not only for me, but my patients, everyone felt so much safer being able to get a consult, being able to get advice from their physician without feeling like they were putting me in danger, and without feeling like I was putting them in danger, because, everybody was well aware that doctors are seeing multiple patients in a day, right? So we can be exposed, which means they can be exposed. And so there's this kind of cycle that everyone's really scared of right now. And that's, I think, where telemedicine has just really taken, rocket speed right now. There's so many people that were in telemedicine before, but it really just never picked up. And that's because I think one of the key things in medicine is that change is hard. I think change is very hard. And I'm sure Priya sees that all the time within hospital institutions, where it's not easy to be the person that wants to change things up. People feel threatened. I know, in the space that I'm in right now, some of my colleagues, I think, feel like, what are you doing, Payal? What is this? Like, how are you trying to take away our profession? Are you trying to kind of, do something that's gonna kind of threaten my ability to see patients now? So it's when you're a change maker, and this might be for later, you are going to be disruptive. You are going to ruffle some feathers. And I think that that's one thing that I learned this year, is that not to be afraid of that.
Yeah. And can I just pick up on both of the things that Susan and Payal said? I think their experiences are so awesome. And I've sort of been in a different situation, but still able to innovate. So I just want to touch on that a little bit. So Payal talked about healthcare institutions, and you know, the American Hospital Association, where I work, is an institution. We've been around for over 100 years. We represent over 5,000 hospitals across the United States, physicians, other providers as well. And we represent a lot of institutions that have been around even longer than us, and that don't necessarily have the reputation of being the quickest to move and the quickest to change. And so COVID really provided us this tremendous open landscape, to use the term that Susan shared, to innovate and change how we do things. And obviously the most visible sort of way we did that was through telemedicine, right? Like all of a sudden we had to provide care to people at home instead of having them come into the hospitals. And we had to figure out the right mechanism for who was going to be cared for, where, and how. And that created a tremendous upset to the process and what people were doing in a day-to-day life and how they were taking it in, right? So it wasn't just for patients, but it was also the employees. Like, how are we taking care of the health and well-being of everyone that we're responsible for during this pandemic? You know, and earlier Payal mentioned some of the feelings that clinicians had around not just PPE, but their safety and their well-being and their ability to handle and manage increased workloads. Seeing so much death and sickness on a day-to-day basis, that's not something that many of our clinicians were used to seeing at the rate that we were seeing it happen, especially in New York and Washington State as this began, and we didn't really know how to treat COVID, right? Like when this started, we had no idea how to treat COVID. And so it really became a huge challenge for hospitals to manage all of this at the same time, while dealing with every other pressure that they already had. And so, you know, it was really interesting and really stressful to watch them take this on. And I remember having a conversation with a physician who was also a CEO of a health system in New York City about 2 months into the pandemic. And he said one of the things that they were trying to do is just make sure that people were staffing everything they needed to staff. And so they had some individuals who were dental residents who said, we'll do anything, sign us up to help in any way that you can, right? Dental residents. So they didn't know what to do with them. So because of where we were with COVID, they also had these mobile morgues that were parked outside of the hospital. So they had 2 mobile morgues where they put the dead bodies. And so they decided to have the dental residents staff the mobile morgues and being in charge of making sure what was coming in, how all the documentation was being done. And within 20 minutes of having the first shift of these dental residents there to cover the mobile morgue, they had panic attacks, anxiety, and they couldn't do it because a dental resident has never dealt with dead bodies. And I hate to bring up a morbid example of that, but it was the perfect example to show something that was so new, because a hospital has never had to have a mobile morgue before, right? And it was, how do you staff that? Okay, well, we have these people that want to do anything and we put them there, but we didn't give them the training, the support they needed to take this on. And so it was a real eye opener for that CEO. And he shared that story numerous times with other CEOs through our AHA events and whatnot, to sort of drive home that point that we have to be taking care of our workforce and we have to be making sure that they have the things that they need to treat patients and take on this pandemic. And so much of what we did, especially around PPE, was really focused on that frontline healthcare worker and making sure that they had what they needed. And it actually led to a lot of really good collaborations across the country between hospitals and other stakeholders. But even at the national level, as the American Hospital Association, we came together in so many new ways with the American Nurses Association and the American Medical Association, so that we could actually be working together on these issues rather than in our own silos.
Yeah, and thank you so much for sharing that that example, Priya. It's for someone who hasn't experienced hospitals the way that you have, that's the example to drive the point home, right? And it's so transferable to every other situation. That's not just a healthcare example, right? I sit in Canada where we're not the first ones to innovate, I'll admit it, right? Most companies like pulling teeth, show me where this has worked before and then I'll maybe think about it, right? It's one of those type of attitudes from a leadership and board perspective. But these are the type of times, the trying times, where we need to be a change maker. We need to think about what specifically do our people need so that they can deliver for your customers, whoever they might be, right? In this case, bad example to call it customers, they're patients who are more than just customers, right? There was an example, question specifically for Payal. Robindeep is asking, how can biometrics contribute to the healthcare? Robindeep, would you like to unmute yourself and share a little bit more about that question? Maybe there's more context to it than I'm not doing it justice. Robindeep, are you still with us?
I think he just needs to be unmuted.
I have given her the speaking rights. She can speak if she wants.
Okay, if not, Payal, if you don't mind, maybe I'll invite you to start answering and maybe Robindeep can jump in.
I guess I'm not really sure. So can you repeat the question about biometrics? Oh, I think.
Yeah, she's there. Yeah.
Yeah, hi everyone. So yeah, my question to Dr. Payal is, how can bioinformatics can contribute in the healthcare sector?
Yeah, can you just speak to an example of the bioinformatics that you're talking about?
Yes, so bioinformatics is basically using biological data and computational tools. And so I don't know much aware about a healthcare system. So is there any chance that bioinformatics can contribute their part?
Yeah, I mean, I don't know if this goes into more like the artificial intelligence and how we can use, just computers and our ability to kind of put together large groups of data systems and then make change based on that information that we gain. So I think that that's a big thing that a lot of people are looking at right now. That's not specifically what I'm looking at necessarily in my company. But I think in any new innovative change that involves computers and the access to large amounts of data, I think that there's always ways to use that data, but we have to figure out how to use that data properly. So I know a lot of people are talking about wearables, like things like your iPhone watch and things like that, where you can get a lot of data from those, but is it helpful data? So, if your heart rate is a little bit elevated, or if it catches a little bit of an abnormal rhythm in your heartbeat or whatever, and then it kind of alerts you. Now, is that going to be a positive alert, or is that actually just going to cause more anxiety? So, there's a fine line between the information that you can get from something about where your body is at and what's happening in your body, and then between it just falsely kind of triggering these alarms that can lead to even more kind of stress and anxiety. So, I think that that's a little bit of a tangent on what we're talking about right now, but I do think, I think that there's a lot of people looking at that space, and I think that there will be some helpful information that we can gather and potentially get people to the emergency room faster based on the data that we pick up. But the devices that we use have to give us accurate information.
And I just wanted to share one key element with data that is extracted from biometrics is consent. So I think we need to talk about what region we live in. Is it Europe? Is it North America? Because to collect all this data is great, but you also need consent. And so there are a lot of companies that are looking at, they've got this great technology, but how do you implement it in a responsible way? And that has to be a key factor. What we're doing with our platform is we seek consent from everything. And when we start generating trend reporting so businesses can make decisions, we anonymize all that information. So that just gives you a little bit of insight into how complex it is. Although it's a great technology, we need to look at the front end all the way to the user, to the back end, and just making sure that that information is being used in a responsible way and extracted in a responsible way. And Priya can probably speak to it because she's from hospital and she completely understands, and she's a lawyer. So I will step out right now.
No, I think that is like perfect, Susan, because it sets the stage for all of the challenges that there are with that type of information. And you touched on a lot of them really well. I just wanted to add that there's that other complexity around health equity, right? Like every community and population is different. And so if we take that data and we don't slice it into what we call race, ethnicity, and language data, or SOGI data, which is sexual orientation, gender. So if we don't slice it in different ways, we're going to have all this data that doesn't necessarily tell us the real story for the actual patients and the populations that we serve. And another issue that has been raised that is connected to that with AI is a lot of the algorithms that have been built and the large swaths of data that get fed into those algorithms aren't really reflecting what's happening to different populations. So it's not reflecting what's really happening to Black Americans or South Asians in America or other populations. And so when you put bad data into an algorithm, the result you get is not going to necessarily be the right result. And so there's a lot of challenges that I think hospitals face as they're working with tech companies to build the right sort of informatics going in, algorithms to process, and then what's being fed out to make sure that it is accurately reflecting the populations that they're serving.
Absolutely, Priya. And it's one of those things, right? If I look at what each one of you just shared, there's a lot happening in the market these days around the use cases, the regulations, the data sets that are being created, and all of that is happening all at the same time. And my view personally is that data is actually foundation for all of these disruptive technologies that we're creating right now, right? We mentioned AI, we mentioned IoT, right? Internet of Technologies that basically allows all of these different types of devices and technologies to come together and solve a particular problem, because no one company or one particular even stakeholder can solve all of the problems. They all have to somehow come together and collaborate. Then there's this, I don't know if you read in the news this week, there's hybrid AI, right? People have been talking about quantum computing for a while now. And people kept asking themselves, is it here? Is it not there? We've heard mixed things in the news. Well, somebody's already found a way to mash that up with AI. So that's getting even more complicated. But data is a double-edged sword, right? So you could do a lot with it. It can help confirm your confirmation biases, if that's what you're looking for. It can help negate them. It really depends on your perspective, in my opinion. And going back to what Priya just shared, right? It's really about being open and transparent about what problem you're looking to solve and inviting those different perspectives in and saying, hey, this is a problem that I'm focused on. What do people think about this? This is the data set that I'm using, because one of the bigger problems in technology is if you look at how data sets are being pulled together, companies like Google, Microsoft, they're all doing their own research in the area, and they're the biggest hub of data right now, right? Even Facebook. So there are already some powerhouses, right? An individual person could start today and start collecting data, but you're not even going to come close to that. So it's one of those conversations that needs more discussion for sure than what we could do it justice for now. So I hope, Robindeep, that answers a bit of your question. Because that's such a wide question. We could talk about it all day long. So the other thing that I'm wondering, right, speaking of data and speaking of so many different stakeholders, how did you bridge collaboration across all of these different ideas, different people, different problems during COVID when everybody was remote?
I think for me, to be honest, this has all been made easier. I think in a sense, people are more open to being collaborative. That, like Susan said, she had meetings with people in India, with people all over the world. And, you know, even my team for our startup, we are in Australia, England, South Africa, Brazil, Chicago, New York, you know, so we're everywhere. And I think that for me, one way, I mean, the reason that I'm on this panel, for example, is Clubhouse. I know that it seems silly, but it's an app that is kind of a mashup between a podcast and a chat room. And I think that, there's been a lot of energy on that platform just recently. And I think it's because people are yearning for that networking that we used to get in person at, networking events and at conferences that aren't available to us. And now it's kind of, this kind of hyper momentum towards like these chat rooms and these spaces where you can meet up with all these people that you're trying to meet up with on LinkedIn and things like that. And so I just want to say that, reaching out to people, putting a feeler out there should not be scary, should not be anything, because if they don't reply, they don't reply. But if you get a reply and you get a meeting, then that's great, and I think that that's what I've learned over the past year is I've reached out to a lot of people, and some of those feelers haven't produced anything and some of them have. And so it's really just, to not be afraid to reach out and to try to make those connections that you think will be helpful to move your idea forward.
Yeah, I'd just like to add, I think one of the things that we've seen from a hospital field, and I've seen in my own personal work at the American Hospital Association, is when you are collaborating around a common cause or a common value or for a greater good, people come to the table and people want to be part of the discussion. So I was in charge of leading our 100 million mask challenge, and that actually started at one of our hospital systems in Washington State. And they came to us, early in March and said, hey, we did this for us when we hit the first COVID hotspot. We think you need to take this challenge nationally. And so I got a call that said, hey, will you take this on? We're doing it. And, bring together whoever you need from across our association, work with whoever you need outside of our association, all rules, all red tape gone. Your goal is to find as many ways as possible to increase access to PPE across the country. You're not just going to work with hospitals, you're going to work with individuals, with businesses, with manufacturers, whatever you need to do, go do it, right? And so we had this common goal of getting more PPE for providers. And so I was able to, build relationships with Microsoft and other Fortune 500 companies that had never previously worked with the American Hospital Association. And we came together without any formal agreement. We just got on the phone and we said, what can we do together? Who can we connect to? We even built a donation app platform with Microsoft and Kaiser Permanente and a number of other partners, and that took PPE that people had to donate and matched it with hospitals that needed it. And we even had a partnership with UPS to handle the shipping. And this was all stuff that our teams at the AHA had never had to take on before. We would never have done a relationship with Microsoft or UPS or Kaiser without something in writing that says, this is our purpose, this is where we're going. But we did, and we had to, because if we had stopped to do all of the process and procedure that we normally did, we wouldn't be able to get to the solution that we needed in the time that we needed it. And so this collaboration and this idea of bringing people together, I've never seen it the way that I've seen it through this COVID pandemic. And then to Pyle's point, taking that personal and taking that to each of us as individuals, as a leader, the collaborations I've seen that have come out of LinkedIn and Clubhouse and even Facebook and Instagram, to be quite honest, that have connected thought leaders and clinicians and the right people together to have the right conversations to educate communities about how to stop the spread of COVID. Now it's all about vaccinations, and it's really exciting to see. And I hope that one of the things that stays after we come out of the pandemic is that desire to work together on a common good and that willingness to collaborate without the red tape and to really partner in meaningful ways.
Yeah, I just wanted to add, I was involved, this is way back in May when COVID just started. I was working with my husband who's in medical devices. We were working in the same kitchen, and I overheard a conversation. He was reached out by a group of manufacturers out of Ontario. They were car manufacturers, furniture manufacturers. These were all leaders of companies. They were shut down because of COVID, and they called Paul, my husband, to say, We want to build ventilators. We don't know how. Can you show us how? We've got people, we've got manufacturing, we've got engineers. We want to build ventilators. Long story short, and I jumped in. I was just helping them on the marketing part of it. These guys, they were manufacturing, very blue collar workers out in a small town outside of Toronto, raised $250 million from the Canadian government to build ventilators. And so I wanted to, when we talk about accidental, you're talking about people who had zero exposure to the healthcare industry, who put up their hand to say, what can I do? We're helpless. We're all shut down. We think we have the equipment to build ventilators. How do we do this? How do we get this ventilator approved through Health Canada, which is similar to on your end? What's the Gunjan, what's the equivalent of Health Canada it would be FDA. That would be the equivalent. And so getting through all that regulatory, that was actually pushed through very, very quickly. And at the end, within 2 months, they got that funding. And now there's 3 facilities out of Toronto, out of Canada, because Canada did not manufacture any ventilators. And so we didn't want to be reliant on exporting ventilators from other people. But I just wanted to speak about the immense collaboration that has taken place during COVID. And one day, I'm sure somebody will write a book about all these crazy people who thought that they can jump in healthcare. But it's been
I think there would be many, many books, Susan, many books.
Really, overall, just so inspiring, right?
Yeah, can I just add one really fun example to that? So around PPE, like the excitement of every individual to be able to contribute to that in some way. I mean, we saw individuals sewing masks in all different, sewing by hand, sewing by sewing machines, like delivering those to different healthcare workers and different clinics and nursing homes and whatever. Everyone wanted to do something, right? So everyone's locked up. We're facing this horrible thing together and they want to help. 2 great stories. One, there's a story of this little boy who his mom was a nurse, and he got a 3D printer and he started printing face shields, an 8-year-old boy. Okay. And then another example, there's a National Bobblehead Museum in Cleveland, Ohio. And they actually created a Dr. Fauci bobblehead and a number of other bobbleheads that, Dr. Birx and some of the governors that were really active in this COVID, in the COVID process early on. And he donated $5 from every bobblehead that was sold to the 100 Million Mask Challenge, our challenge at the AHA. And just through sales of bobbleheads, which is, I didn't even know that many people bought bobbleheads, $350,000 that we were able to then use to purchase PPE, put through that donation app that I mentioned to you, and get to hospitals. And so it was just the ingenuity and how people thought to come and be a part of this together. Mm-hmm. It was just so inspiring to see.
Absolutely. And I hate to cut this short, quite frankly, but we're running out of time. So one thing that we all agreed to do ahead of the time actually was to leave our audience with one thing, and one thing only, that could be a takeaway, which will inspire as a takeaway from this conversation, right? So I would like to invite you all to leave us with that one thing, if you don't mind. So who would like to go first?
Okay, considering I'm unmuted, maybe I'll talk first. I want to talk about if, in order to be successful in not just healthcare, but in anything, I think personal credibility is what I would say is number one. So in order to get the collaboration, in order to solicit feedback, get insights, you really have to build your own brand. And I encourage everybody, the one takeaway is reach out to one person a day for the next 20 days, people you've never spoken to. COVID is a great opportunity to say, hey, how are you? You don't want anything for them, but it's just a matter of building your network. So 2 months, 3 months, half a year down the road, people will remember you, and you're not only contacting them because you need something for them, they will remember you. So I think what's really helped me with my network and with my business is the fact that when I speak to people, they don't see me as a healthcare girl, but they see me as somebody that is able to execute, somebody who is credible, somebody that that has just reached out for the sake of reaching out in the past. So I think it's really important to build your own personal brand, and that'll really help you in whatever your endeavors are in soliciting collaboration.
I love that, Susan. And it is something that I've been able to spend more time doing because I'm not spending time commuting or traveling. And so I love that. I would just share, we've lived through an incredibly stressful and hard year, all of us, each and every one of us. And so I would say what I would have my takeaway be is to pay attention to self-care. We can't truly lead unless we're taking care of our own cups and making sure that they're full. And so I'm not talking about massages and manicures and pedicures, although I really want to get back to a regular regimen of all of those things. But thinking about the basic things like sleep, nutrition, exercise, and then the things that you want to do for fun and enjoyment, because that's a huge piece of well-being. And then how are you building time for that? How are you making sure that every day you are able to ensure that you're sleeping right, you're exercising, you're eating right, you're taking care of your body, and then of course, taking care of your mind, right? Looking at your mental health, your mindset, your spirituality. And then sort of the last area, which is really hard, I think, for women and women leaders is the boundaries, right? Like what boundaries do you need to build to ensure you have time for all of those other things that I just mentioned are part of self-care? So I think I would challenge everyone to sort of make a list of how many hours you want to sleep, how much, what's a health goal that you have for yourself, whether it's exercising or eating healthy. How are you going to take care of your mind, and then how are you going to have fun? And so that's my takeaway.
So Priya, great minds think alike. So I actually had the same takeaway, but I'm actually going to give, because you expressed it absolutely beautifully. And that was my takeaway actually this week when I kind of hit a wall. And prior to hitting that wall, I wish I had just taken a moment to check in with myself and to check in with my family and to see how I could have been doing things better. Because we're all working from home, that work-life balance is totally skewed. And when you're working on something that you're truly passionate about, and also when it's something that's new and it's like a little infant and a baby, really, you have a tendency to want to just do, and you lose sight of like the big picture. And I think right now is like, it's just even harder because everything's just together. So our office space and our home space is just one space. So I agree with you. And so then I want to give the takeaway that you gave to us, actually, Priya, the last meeting, which was regarding imposter syndrome. I really liked that. And I think it's very, very helpful. I think we all, when I got asked to be on this and then I saw what Priya and Susan were doing, I had imposter syndrome. I didn't know if I should be on this panel. And I think
Kyle, think of me. No, I'm
and then Gunjan, and like the whole thing put together, you're the leader of TED Circles. And so it was just one of these things that I did not know. And so what Priya said the other day, which was to make a list, and I've done this in the past, but to make a list of all your accomplishments. And I do this actually on a yearly basis. I sit down and I think, what did I accomplish over the last year? Because sometimes we take things for granted. We take things that we've done and accomplished for granted because we're in it, right? And so sometimes you have to step back and look and see, these are the things that I've actually accomplished. Like I have taken care of an 8-month-old by myself for the last 8 months, and also helped bring to life a new startup in the telemedicine space out of nothing. So I need to congratulate myself. And if I don't do it, no one else will. So that's just my take home, is just sit down and congratulate yourselves for the things that you've accomplished.
Absolutely. And thank you so much for sharing that. I'm actually going to put mine in the chat real quick. And we kind of touched upon it earlier. Right, data is one of those things that as a consultant, I worked with it a lot before, but through COVID, how many different dashboards did we see? How many different holes did we find in the way that we run lives in the name of data and in the name of facts, right? We saw all of that with politics. We saw that with COVID. We saw that in healthcare, beyond healthcare, and businesses. So data for me, as I said earlier, become this double-edged sword, and we really need to be careful. I'm very passionate about inclusive innovation, right? how data is being used in the name of diversity and inclusion is really fascinating. So I've put a quick little link in the chat to HBR. I also work with HBR as part of their advisory council, and they're doing a lot of work in inspiring leaders in small ways and how to think about this, right? We talked about collaboration, we talked about leadership, and yes, this was a female-focused, women-focused panel. But everything that we've discussed here, it doesn't matter whether you're male or female, it applies to everyone, right? At different age groups, at different industries, even outside of healthcare. Many industries are dealing with some of the challenges that we've talked about. So I know I'm deathly over time now. So I'd like to turn it back to Akanksha to help us close this session. And thank you so much for having us and setting the stage for this.
Thank you, Gunjan. Women, the heart of healthcare. As the topic for today's webinar suggests, the workers are the beating heart of every health system, and the majority of them are women. I was reading a pre-COVID census report that states women have increased their participation in record numbers in healthcare occupations that require higher education. It's only going to grow. Now, on behalf of the Punjabi Chamber of Commerce, I would like to thank everyone who was able to join us today. I would also like to extend a vote of thanks to all of the speakers for gracing us with your presence and sharing with us a bit about yourself, your personal and professional journeys, and the important work that you do in your respective fields. Susan, the accidental entrepreneur. Like everyone else listening to you, that your words made me smile. Accident or not, the way I see it, it was meant to be. I wish you all the best in what you do. Priya, kudos to you for all that you have achieved in your professional career. The work that you do at AHA, excuse me, and your efforts to guide hospitals and health systems is even more relevant during and even more after COVID-19. There will be an after. And I love what you said about self-care. It is definitely at the top of my to-do list these days. Physical, mental, spiritual, and emotional check-ins, as Payal calls them. Payal, on behalf of everyone listening, I would like to acknowledge you and all of the medical professionals, healthcare workers for the work that you all do. Our sincere thank you to all of you. I would also like to thank our audience for taking the time to join us today. We look forward to your participation so we can continue to bring you more such programs and hopefully some in-person events when it is safe to do so. To tell you a little bit more about our organization, the Punjabi Chamber of Commerce is an initiative to offer professional mentoring, seminars, webinars, workshops, and networking opportunities. Our goal is to provide a community for professionals with a shared heritage, background, and experiences, and for our younger generation to have an opportunity to participate, appreciate, and learn from our rich legacy. Although we are the Punjabi Chamber of Commerce, the participation is not restricted to Punjabis only. I am happy to be a part of PCC, and I thank our trustees, board, and all of our members for their support. I would also like to thank our moderator, Gunjan Sayal, and Vanita Chitkara and Jeenia Nath of Punjabi Chamber of Commerce for your help in organizing this event. A big thank you to all of you. This is Akanksha Kalra signing off.